involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to Ask the Pediatrician webinar. I hope you are having a nice day, whatever time of the day and whichever platform you're watching. I want to say welcome to ATP webinar. I am Gbemisola Boyede. I'm a pediatrician and your anchor for today's episode. ATP webinar is one of the programs we bring to you from Ask the Pediatricians Foundation to educate you as a parent, as a caregiver of children, on important health issues that affect our children. And you can watch all our past episodes where we have discussed almost all the most important topics on children health issues, from immunization to nutrition and so on, and common diseases in children. We encourage you to watch and to listen, and you will learn from them. And so again, today we're going to be talking about something also very, very important. And if you've seen the banner already, you know what we're talking about today. Today we're going to be talking about something that is so vital that we should talk about. We're talking about antibiotics and medication misuse in children. Antibiotics and medication misuse in children. However, before we start, I just want to let you know that if you have any questions following today's teaching, feel free to go to Ask the Pediatrician Facebook group and you can post your questions there for us. Our professionals, our moderators, they'll be there to approve your questions and provide answers. So you can ask any question whatsoever that has to do with the health of your children. We're always on the online platform from Mondays to Saturdays, every hour of the day, 24 hours, Mondays to Saturday. You can post your questions there and we'll try our best to answer your question within 72 hours. So feel free to post your questions. And if you have any other topics you'd like us to address on this webinar series, feel free to email us, askthepediatricians@gmail.com, or you can also post it on our group and we'll try and address them in future episodes. So thank you so much for joining me, whether you're joining from Facebook or YouTube or our Instagram live, or you're joining from Fresh Waves Radio, or you are rewatching the recording on our Facebook group, or you're listening to us on our podcast. I want to say thank you so much for joining, and I hope you learned something important. So back to the topic of today, we're talking about antibiotics misuse and misuse of other medications in children. I decided to add other medications because it is not the only one. Antibiotics are not the only ones that are being misused in children. There are lots of other medications, but obviously antibiotics are the number one medication or group of medications that are often misused and overused in children. And sometimes parents don't know that this is a very dangerous thing to do. And this is something so dear to me and heart. And I felt like we really need to talk about it. I doubt if there's any parent who is listening to me who have not misused antibiotic. Okay, so do a quick check of yourself. Have you ever given your child antibiotics that has not been prescribed by a pediatrician or a doctor? Have you ever used antibiotics without a doctor's prescription? That's the first question. If the answer to that question is yes, you have misused antibiotics. Have you ever given your child antibiotics longer than the period that the doctor asked you to give? If yes, you have misused antibiotic. Or have you ever given your child the medication for not up to the number of days you are asked to give it? Or, you were supposed to give it for 5 days and you give it for 3 days, your child is better and you stop using the medication. Yes or no? If the answer is yes, you have misused antibiotics. Have you ever given your child antibiotics for a child who just have cough and catarrh? Of course, without the doctor's prescription again. If yes, that is a misuse of antibiotics. Have you ever given another child antibiotics that a doctor actually prescribed maybe for the brother or the sister, but when the child now has another child in the family has similar symptoms, you decided to use the same antibiotics without actually taking that child to a pediatrician or to a doctor first? If the answer to that is yes, you have misused antibiotics. So I can see, and I'm sure most of you have answered yes to one or even most, maybe all of my questions. In that case, you are the one that I really need to talk to. Do you know that what you're doing is so dangerous? It is very, very dangerous. And this is not an issue that is just peculiar to maybe us in Nigeria. This is a global issue. It is not just it is so rampant. It is one of the major issues that we have to talk about when it comes to health issues, and there's a lot of danger when we do what we call antibiotic overuse or antibiotic misuse. And I'm sure by the time we talk about it today, because some of us will do it because we don't understand that this is not just about your child alone. This is not just about maybe this your own issue alone. This is a global issue because there are lots of danger, and in fact, one of the issues that the World Health Organization is dealing with right now is what we call um, growing rates of antimicrobial resistance. In other words, most of these germs that cause infections, um, we treat them with drugs, and antibiotics is one of those drugs we use for the bacteria, but there are other germs too that we use drugs for. So if you want to make it a broad terminology, we a broad term that will cover all of them, we call them antimicrobial. Now we're finding out one thing, that most of these antimicrobial, of course, antibiotics being one of the largest group of them all, the germs or the pathogens are developing resistance to them. In other words, so when we now give our children or ourselves the medication, the antimicrobial that's supposed to work against this particular germ, it doesn't work anymore. Why? It's because the germs have developed resistance against those drugs. So the drug is as useless. So, and it's one of the major public health issue right now. We are actually in a dangerous situation because one of the reasons why we are all living so long and we are all enjoying good health today is because when we are sick, well, these germs come into our body, whether they are viruses or bacteria or fungi or other um, organisms that come into our body. One of the tools that we as health professionals use to help you get well is by giving you drugs that can work against those germs, and it will neutralize them, kill them off, neutralize the effect, and you get better. But do you know what is happening now is that these germs are now becoming resistant. In other words, so if somebody is sick because a particular germ is multiplying in their body or in their blood, now we give them drugs that's supposed to clear that germ, and it can't because the germ has become resistant. Then we are in a desperate situation because that means there's nothing we can do, and that person can actually die. So, this issue of antimicrobial resistance is now a major public health issue, and it's a major threat. It's a serious threat. And you now begin to wonder, what has that got to do with me? That what has that got to do with my baby? Is because one of the reason, in fact, the main reason for this antimicrobial resistance is the misuse and overuse of those antimicrobials in humans, and also, in fact, including plants and animals as well, because people also uses them. But I'm going to focus on those of us who are humans. So each time you answer yes to those my questions, using antibiotics without a prescription, not using it when it is not necessary, using it when or using it when it has been prescribed for a particular condition of another child, and now you're copying and pasting it for another child because the symptoms are similar, you are also contributing to the growth of antimicrobial resistance. In fact, it is estimated that bacteria antimicrobial resistance, of course, antibiotics, was directly responsible for 1.27 million deaths in 2019 and contributed to almost 5 million deaths. So this is not a joking matter. This is a very, very serious issue. 1.27 million people died all over the world because of what we're talking about, because the germs that was affecting them has become resistant to the drugs that we can use to treat them, and they died. And it's also part, of course, maybe not the only reason, but it's also part of the reason why 5 million other people globally died just in 2019 alone. So we're talking about things that have to do with life and death. We're talking about things that can lead to death. And when we talk about children, it's even more serious. So misuse and overuse of antibiotics, antimicrobial is the main driver for these resistant pathogens. It is the main driver. And for those of us who live in Nigeria, we know. I don't know whether WHO has the statistics, but and we know that drug misuse and overuse is common in all over the world. But I think in Nigeria, and particularly in West, those of us in Africa, we are the most uh, prolific abusers or misusers, if you like, of antimicrobial, especially antibiotics. And what even worries me more as a pediatrician is that most of us don't even misuse or overuse these drugs for ourselves. We actually do it for our children. And we're already setting up our children for this scenario where the germs that was causing illnesses in them will no longer work because they are now resistant. And they are resistant because we as parents have misused and overused these drugs. So please, this is a very, very serious issue. Most of us don't think about that. An average mother can walk into a pharmacy in Nigeria and buy any antibiotic, and that is a shame. Okay, because that should not be happening at all. I know there are countries where that doesn't happen, and that's congratulations to them. But let's talk to those of us where this is an issue, because the solution is not the government, the solution is not police and all that. The solution is for us as parents to understand the harm that we can cause our children through the misuse of antibiotics. I answer questions on a platform that is public, and on Facebook every day we answer questions in hundreds, we answer thousands of questions in a week. And one of the commonest questions people ask me, oh, my child has this and that, what can I use? And guess what? Even before I between approving those questions to answer it, a lot of other mothers will jump on that post and start saying, "Go and buy that antibiotic. Go and buy that antibiotic A or antibiotic B or antibiotic C." This is a platform that is owned by pediatrician, where there are doctors, where there are health professionals, and people are comfortable coming to that platform to even under our nose be telling people to go and use certain drugs. Of course, you know what we do, we block those kind of people. That is one. Then the parent themselves will come and tell me, "Oh, my child has this and that. My child has," let me give a common example. "My child has diarrhea. I have given flagyl. I have given tetracycline, antibiotics. And then you wonder, why is that going on? You know? So, and most children have diarrhea. Most of them are due to viruses. So, using antibiotics in a child who has diarrhea, antibiotic abuse, antibiotic misuse, antibiotic overuse. Again, these are scenarios. And this, then people will come and tell me, "My child has this stain, and then the last time I went to the hospital, the doctor prescribed so antibiotic, and I just decided to give it again." Or when the brother was sick, we went there, "This is what the doctor prescribed. Can I just give it again?" Antibiotic misuse, antibiotic overuse. It is really, really dangerous. I even shiver when mothers begin to tell me, "Oh, I've given Augmentin, I've given Xenas, I've given Horelax." For those of you who don't know, these are powerful, very powerful antibiotics that are up on the list of antibiotic choices that even I, as a pediatrician, will not prescribe as the first line. But an average mother in Nigeria will walk into a pharmacy and tell them, "Give me Augmentin, give me Xenax," and they give it to their children. Some of these mothers don't even know the dose, because obviously, number one, they don't even know what is wrong with their child, whether it's something that requires antibiotics or not. Number two, they don't know maybe the current weight of that child. They, even if they do, they don't know what is the appropriate dose for that child. And some of them will use it maybe for not even to the number of days we use it, or over the number of days that's supposed to be used. So there's so much antibiotic misuse, there's so much antibiotic overuse. I know we have to talk to government here, but I found out that sometimes we as the people, we have to take our own life in our own hands and know what is right and do what is right by our children, because just legislation and all that alone will not solve the problem if we are not ready to change. But just know that each time you are abusing antibiotics, each time you are using antibiotics when you don't need to use it, you are setting up that child for antibiotic resistance, kind of germs. And if, God forbid, as we always say, that child gets ill and then we use those antibiotics and they don't work, we are setting up that child for death. It is as bad as that. And we cannot sugarcoat it, we cannot make it, because I want you to understand how dangerous when we abuse antibiotics. It is a very dangerous game that we are playing. And if there's anything you're going to take home from today, if you don't remember everything I say, make up your mind that you will never give any antimicrobial, any antibiotic to your child that has not been prescribed by a pediatrician. And that also goes to my colleagues. We should desist from somebody just telling us on the phone, "My child has this, my child has that." We just said, "Go and buy that." You notice that some people are familiar with us on ATP. We don't do that. I always say that we don't prescribe medication on our group. There's a reason. It's also part of that, because we do not seen the child. We don't even know what you're telling us, how true it is, and all that. So how do we now know that your child needs antibiotics or particular drugs? It's going to lead to misuse. It also goes down to my colleagues in pharmacy. I know the economy is hard. We're all trying to sell our products. But please, each time you sell a product to a mother who comes to your pharmacy without a prescription, you are setting up that child for antimicrobial resistance, and you know it. You are learned enough to know that. So let's not, because we want to make money, let's not kill our future. Our children, they're our future. So antibiotic resistance is a major challenge. It's a global health issue. It is a major issue that even the World Health Organization does not know what to do. And they know that poverty, low income, middle income countries like us in Nigeria, we are the ones that are the most affected. Because most of us, I understand, we don't want to go to the hospital. We don't want to go and queue up in the, we say we don't have money for the private hospital. Then we'll go to government hospital. We don't want to go and queue and queue and queue. After all, it is the same thing they're going to write for me. Let me just go and buy it myself. And people sometimes want to ask questions in our group, and they post so many pictures of drugs. And we always say don't put pictures, because sometimes it's so scary. So these are the things that are driving us to say, let me just go and buy the drugs. And I see fellow mothers prescribing drugs to fellow mothers, even under my nose, on heart to pediatricians, and of course, before we even block you, So that shows how ingrained that habit is. How we don't even see it as a big deal, but that is a killer issue, something that is killing people. And I've worked in hospitals where we've had scenario like this, where we got to the point that we try all the drugs, because when we have admit an average Nigerian child to the hospital, in other places they will say, well, the first thing you should use ampiclox is, it's not going to work, because the Nigerian mother has used, and I use it generically, so for those of you who don't do it, don't mind me, apologies. Okay, but most of you that do it, you know what I'm talking about. Most of all, before we bring our children to the hospital, you've used the ampiclox, you've used the amoxicillin. Then what do you want us, the pediatricians, to prescribe? Because if you have used already all those drugs and they are not working, because the child has not developed as a germ that has antimicrobial resistance, we now start looking for drugs. And guess what? We don't have an infinite number of antibiotics or this antimicrobial. We don't have an infinite number. So in other words, we have only few antibiotics. In fact, I don't think we have them up to 200. Maybe I don't think we have of them to 1,000. So when your child develops resistance against some of the common ones, we have to start looking for the fewer ones that are rarer. They are actually more expensive. They are more difficult to get. And guess what? We are not discovering new ones. So in other words, we are getting to the limit to the number of antibiotics we have. That's okay, let's use this one, use that one, use meropenem, use nothing else again. We are done. What do we do? Then that means we're going to fold our hands. We can't do anything. And the germs, the microbials are going to win. And that's when they win, that means death. That is what it means. So, but what we can do, there's something we can do, is to make sure we don't abuse, we don't misuse, and we don't overuse antibiotics and antimicrobial generally. For those of you who are just coming, I'm talking about antibiotics and medication misuse in children. We need to stop. It's a dangerous thing when we do this. Okay, it is a fatal issue, and it's actually putting what we call all the things we have gained, modern medicine, it is making it to become very risky. It's making infections harder to treat. So people will have infection, we will use all the antibiotics we know, they are not going to get better, because the germs are now very resistant. Why? Because of antimicrobial resistance, because we overuse antibiotics, because we misuse antibiotics. So you can imagine mothers having cesarean section, people having surgery, and then they develop infections, and then we can't treat them. So they're not going to die because of the CS or the surgery or whatever we did. They're going to die from infection that we can't treat because the germs have developed resistance, which is one of the reasons we don't want people staying long in the hospital, because those germs in the hospital environment, they are even more resistant to antibiotics because they've stayed long in the hospital environment. So that is how dangerous it is. So we should not be misusing antibiotics. So what is misuse of antibiotics? Anytime you use antibiotics for what is not meant for, that is a misuse. It is so simple. It's not, this one is just simple English. It's not technical at all. Let me give you common examples of how we misuse antibiotics. Cough and catarrh. Cough and catarrh. Most cough and catarrh in children is one of the commonest issues that children have as they are going back to school now, going to crèches, going to play group. They are going to cough, they are going to have catarrh. Please don't give them antibiotics. Don't give amoxicillin, don't give ampicillin, don't give nothing for cough and catarrh. Don't, because most of them are due to viruses. So if they are due to viruses, they are going to go by themselves. We don't usually treat viruses with any drugs. Only very few of them will give antiviral, but these are when people are very sick in the hospital. Most cough and catarrh, your child is running up and down, coughing and having runny nose. They don't need any drugs. They don't need any antibiotics. So giving your child antibiotics in such instance is antibiotic misuse. And it's breeding antibiotic resistance germs for that child. 2, diarrhea. My child is having diarrhea. In fact, the average Nigerian mothers give flagyl like sweet. I see saw yesterday somebody, a newborn baby, was said to have passed through 2 or 3 times or 4 times, I can't even remember how, because the child passed through immediately after breastfeeding, and somebody has told them go and give flagyl. There's nothing wrong with a baby passing stool after eating. That is normal. Newborn babies can pass stool up to 12 times a day. That is normal. Newborn babies don't pass hard stool. They pass semi-formed stool. It can be a bit watery, a bit solid. That is normal. And yes, somebody has told them go and give flagyl. Usually, I don't like to comment against when people say my doctor said, but I have to tell them, do not give that child flagyl. I feel as if I should reach out and touch the person through my screen. Like I was almost practically screaming where I was. Like, come on. Then people will say, oh, I go to party. You just take flagyl. I have a little diarrhea, take flagyl. Please. That is the most abused antibiotic in Nigeria. Flagyl, most abused antibiotic in Nigeria. I don't even know whether it's even work for anything, because people use it like sweets and they give it to their children. It's not just these adults using it, so they will give to children. Go and take flagyl. Child is having diarrhea. They've not given ORS. They've not given Oracin. Go and take flagyl. Please stop. Most diarrhea in children, again, due to viruses. The most important thing a child who is having diarrhea and all that is to rehydrate, give back the water and the salt, electrolyte that the child is losing, not antibiotics. That is antibiotic misuse. Some people will go and use tetracycline. Tetracycline will now make the teeth become brown and yellow or green. Then they will say, oh, doctor, my child's teeth is permanently stained. Misuse of antibiotics. Septrin also used to be a commonly misused antibiotics. Everything, go and take Septrin. I think some people have stopped that one now. Misuse. Another thing, which is not antibiotic, but anti-malarials in Nigeria again, abused, because an average Nigerian believes every fever is malaria. It is not true, sir. It is not true, ma. There are many causes of fever. Sometimes our children are simply hot because we are overdressing them in our very hot environment, hot weather. All you need to do is remove the extra clothes, let some breeze blow on that child, and the child's temperature will come down. Some of us don't even use digital thermometer. A lot of mothers will say, my child said it's hot. Okay, go and use the thermometer. Then they come back, it is 36.6. That is normal. The child is not hot. That is normal temperature. Maybe it's your own hand that is hot, and then you go and start treating what is not even lost, So all these things, these are the reason. So every little child has fever, we have fever malaria. People will not say, have fever malaria. I wonder why the child is still having fever. As if, how do you know the child even have malaria in the first instance? Why are you giving anti-malaria? What if the child has a viral infection? What if the child is just hot? What if the child is just dehydrated? These are things can also make the child hot or have fever without necessarily being malaria. We abuse malaria. I know there was a time we were trying to kick out malaria, so everybody we put malaria. I guess it's our own fault. We put malaria treatment in the hand of parents. Now we're telling you, please don't just treat every child for malaria if they have fever without going to the hospital, without them having malaria tests. But I guess the host has already both said for that one. But please, we can still do better. These are the drugs that we misuse a lot in Nigeria, and we need to stop, because what we're doing now is that we're breeding a lot of antimicrobial resistance. What about medicated creams? I know mothers that give their children, that use medication as a regular everyday cream for their children. Skinil, from Bat A, what's the other one? ABR or whatever, AB, whatever. They mix it into the normal Vaseline or normal body cream for their children, and they use it every day. And now that whenever I stop using it, just having rashes, and oh, my child has to be fair, my child has to be, no. Those are medication. They are not just cream. Format A, Skinil, it's not a body cream. It's a medication. It's an antifungal with steroids inside, or with antibiotic also inside, antibacterial. They are not meant for you to use every day on the skin of your children. That is antibiotic, antibacterial, antifungal abuse in children. So I can go on and on and on, but I just giving you some of this scenario, because some of you will see yourself in this scenario. But even if your child was truly sick, please don't give drugs when we have not prescribed it. And let me quickly also, because this are also still very close to me, mothers themselves, when you yourself get pregnant or you are breastfeeding, please don't use antibiotics unless it is prescribed by a doctor, because there are some antibiotics that we don't give to pregnant women. There are some we don't give to breastfeeding mother. If you are breastfeeding, we can't give you tetracycline. It's going to come out in your breast milk. It's going to affect your baby. We can't give it to you. So, and some of us will just go and use all these drugs anyhow. Some of us are pregnant. First trimester, you're already misusing drugs. And then it's going to cause damage to the baby. Sometimes they end up in abortion. Sometimes the babies are born with all sorts of congenital malformations. These are all the danger when we abuse or misuse drugs. Antibiotics are supposed to treat bacteria. So we can't be using antibiotics for something that is due to viruses. Okay, and sometimes it is not every fever that means the child has infection. And people say, oh, some hospitals they won't even do blood tests. So some of you go to this hospital, everybody has malaria, typhoid. Every people in Nigeria are walking up and down, and they will tell you they have malaria, typhoid. You don't have no typhoid. There's no way you have typhoid fever. You'll be walking around. You'll be very sick. You'll be lying down. It's a very serious illness. And I always tell people, please avoid all these hospitals where all the diagnosis they ever make is malaria and typhoid. And how can you always have malaria and typhoid together? And it's very, very rare for one child, to have two diagnoses. It is the exception, not the rule. So every time you go to hospital, even some of you will even go to the hospital, you will go to the lab. And the lab people already know that you will come to them. So, and they have to give you something so that you will come again. And they will just tell you have the malaria is always there. It has to be at least 1+, and then the typhoid always have to be there. And all these so-called wider tests. Number one, wider test is not the way we diagnose typhoid fever. Okay, it is not diagnosis of typhoid fever, and most people who even do it, they don't do it the right way. So it's even as useless as nothing else. But everybody say, I've done malaria and typhoid for wider, I've done malaria and wider, but it's even wrong. And most of these labs, they don't do nothing, and they just write it for you. And they will also be the one who will take over the job of the doctors and treat you. our labs, our pharmacy in Nigeria. I see it with all sense of responsibility. We got to change. We should not be doing tests that has not been requested by the doctors. That is how it works anywhere in the world. We should not be giving drugs that has not been prescribed, that are prescription only medications, because we are contributing to this wave of antimicrobial resistance, and we are having a health crisis already. We don't have enough doctors, we don't have enough hospitals, we don't have enough uh, services, and yet we are doing things that is going to make life harder. But I want to plead with us on behalf of our children that we have to do better by our children, because they are our future. So let's do the right things. Let's stop putting the is it the cat before the horse or the horse before the cat? I always get it wrong, but you know what I'm trying to say. When somebody is sick, a child is sick, please take them to the hospital. What we do on ATP is to teach you how to promote good health, is how to take care of your children so that they won't be sick in the first instance. We pediatricians, we actually don't like children coming to the hospital. We don't need your children to come to the hospital for us to make our own money. We can make enough money just taking care of the healthy children. We have enough work doing our immunization, doing our well baby examination, doing our development. There's enough work. So we don't need sick children to work. Okay. So some of you say, how are you going to make money if people are not sick? We don't need you to be sick. We don't need children to be sick to make our money. Seriously speaking, we want our children to be healthy. So which is why we talk about promotion of good health. Feed your children with good nutrition. We talk about going for immunization. We talk about all these things first. So, but when children are eventually sick, sometimes no matter what you do, children can be sick. They can have infections, they can have all that. Please take them to the hospital first. Let the doctor decide whether this child has malaria or has a bacterial infection. Please go to good hospitals. Don't go to people that will just always write drugs when they've not even examined your child, when they've not done blood tests or whatever tests they need to do to confirm what is wrong. That is very important, which is why I always promote going to government hospitals. There are a lot of good private hospitals as well. You just have to make sure you know the right ones. Of course, you have to do your own due diligence. The way if you go to hospital, they always teach you everything is malaria typhoid, don't go there again. Okay? Every time you go, all your blood tests always have malaria. Not even one day, malaria will never be absent. Don't go there again. Most of those ones are fake. And I say with all sense of responsibility. Okay? Go to standard hospitals that have certifications or labs that have certifications, that when they do your test, they are telling you the real truth. Okay, so make sure let's stop going to lab when our children are sick. Let's stop going to pharmacy when children are sick. We do all these things. These are where the problem starts, because we go to pharmacy. The pharmacy has to sell drugs, so they're going to give you something. They're going to give you antibiotics that you don't need, because they have to sell it. They have to make money. They have to pay their rents and all that. Let's stop going to the lab. If the lab doesn't give you results, that is wrong. Will you come back again? So that's why we need to stop going there. Go to hospital when your children are sick. Go to the doctor first. I'm not saying that because I'm a doctor. I'm saying it because that's the right thing to do. And even my colleagues that's in the labs and pharmacy, they know that is the right thing to do. We all know. We all went to medical school. We all know what we should be doing. Okay, so let's do the right things for the sake of our children. Go to the hospital first. See a doctor. Let them examine the child. Let them know where the fever is coming from. If they are not sure, let them do the blood test. Let them do the x-ray. Let them do whatever they need to do. And then when they are done, sometimes for some antibiotics, we need to take part of the jam and send it to the lab. That is where our lab comes in. We can take a culture, the child is having hair discharge or high discharge or throat infection. We can take a little bit of it, send it to the lab. The child is having urine infection. We take a bit of urine, send it to the lab. The lab will test it and tell us, oh, it is Staphylococcus aureus, it is staph. I mentioned Staphylococcus aureus because somebody was asking me the other day, can this lab test staph? As if staph is just the name of a bacteria. There's nothing special about it. There are other bacteria like streptococcus, like Haemophilus influenza. There are so many bacteria. Don't let the herbalists in Nigeria confuse you with staph and make it look like it's one big disease. Staph is not a disease. It's just the name of a bacterium. Okay, but there are other bacteria that causes infection. And sometimes the labs will be able to tell us for this particular infection, this is the best antibiotics. Of course, sometimes because the lab is going to take 48 hours, 72 hours to come back with that result, we can't wait. So medical science say start with the likely medication that we use for if somebody has urinary tract infection. Well, we know it tends to be this particular kind of bacteria, E. coli or whatever. Okay, these are the kind of antibiotics that work for those kind of germs that we expect in that area. So we usually will start with that, something that can cover what we call broad spectrum. Then when the result come back from the lab, if what we are using is also the germ is sensitive to it, we'll continue with it. If what we are using, the germ will not be sensitive to it, then we will change to what the lab advises us to change to. That is how it works. And then we will tell you, go to the pharmacy. This is the drug the pharmacy should prescribe for you. And then we'll calculate how much of the drugs you will take. And do you know what? Even for the same drug, the dose may be different depending on the infection we're treating. So if I'm treating a child for meningitis, infection in the brain, or so staph, for example, let me use staph because all of us like know about staph aureus. It can cause a boil. It can cause boil, staph. But it can also cause what we call sepsis, septicemia in the blood. It can also cause meningitis in the brain. So if I'm going to give you antibiotics to treat boil, the same germ, the same bacterium, staph aureus, the dose of antibiotics I'm going to give you for treating your boil, it's not going to be the same I'm going to use for treating a meningitis infection in the brain. The method I'll use to give the antibiotics, so if I'm treating the boil, I'll give you something you can take by mouth. And that is it for boil that is due to staph aureus. If staph aureus has caused infection in a child's brain, I'm not going to give you oral ampiclos. I'm going to give you IV cloxacillin. I'm going to give you something into the blood that will get into the brain to clear the infection in the brain. The dose I'm going to give will be different. So these are the reasons why we can't just say go and use this drug. People do that a lot, and they don't even understand what they're doing, because the way and that is why the dose we will give to A will be different from what we give to B, depending on what we're treating. Also depending on how severe the infection is. Also depending on what kind of what is the weight of A versus the weight of B. It is not the same dose that we give, because somebody may be 1 year old and be weighing 10 kilos. Another person may be 1 year old and be weighing 12 kilos. It's still not the same dose we give the two of them. Okay, so there are things that we think about. What if this particular person is allergic to that particular antibiotic? And I have to think of what is the child not allergic to. Some people have what we call penicillin allergies. So if you have penicillin allergies, we're not going to give you ampiclos or amoxicillin. We have to give you something different. Maybe we'll go to some other antibiotic like erythromycin, something that will still do the work, but will not give you allergy. So there are things that doctors think about when they are giving drugs. People who are not doctors don't think like that, because they don't know, because they are not trained to do that. They are not trained to give drugs. They are to prescribe drugs. They are not trained to think about that. They just know that one day somebody say, "Oh, I have this kind of infection, and this is the drug they gave." So we just keep giving it to everybody. That's not how it is done. So this is why you should go to the hospital first. If you don't have money, go to a government hospital. They will still see your child and tell you the drugs to go and buy. You just have to go and buy your drugs. But at least they will see your child first. Okay, and they will see. So these are important things that we need to be aware of. So let's not use antibiotics indiscriminately, because when we do that, we are going to end up with antimicrobial resistance. So my time is up. As I'm going to round up, I'm just going to give us some tips as parents, what we can do. So I've already emphasized the fact that we need to go to the hospital when our children are sick. If you don't know what to do, ask us on ATP. Yeah, we will tell you what to do. And I know some of you don't like it when we say, this one you have to go to the hospital, because what we do on ATP is like we kind of triage for our colleagues. So when you come and we say, oh, what you are describing look like something that is maybe it's even normal. Some of you worried about everything, even normal stuff. We can tell you, okay, this is normal, you don't need to do anything. Or maybe it's something that you just need to watch and wait it out. My child does not bring out teeth, the child is 1 year. We just say just watch and wait. There's no need for you to go to the hospital. But when you come and you tell us some things about your child, of course, the child has to go to the hospital. I saw somebody post a picture of very dirty wound, or big abscesses on the child's tummy. That is not something we're going to treat, and that is not something you would just go to your pharmacy or chemist shop and buy. And that child needs to be admitted to the hospital and put on IV antibiotics. So we will tell you this one, you have to go to the hospital. So don't get upset, because there are some things you have to go to the hospital, whether you like it or not. It is about life and death. It's about what is important, what should be done, not whether you like it. Some people say, I don't have money. We're talking about life here. If you don't have money, go to the hospital. They will look for the money for you. They will, by the time we call everybody, then you will find money. We've done it before, we do it again. So we'll go there first. At least maybe when you are there, you will find the helper. Okay, and these days there are a lot of health insurances like Eco. I think the Lagos State government has started their own state insurance. Some of them just little money. Some of this money that we used to buy data, some of the money we used to buy Coke and shawarma, they are enough for you to pay monthly, and your children and yourself will be covered, so that when you're sick, you go to the hospital, you won't have to pay. Health is never free anywhere. Somebody is paying for it. That's the illusion for those of us in Africa. We think everything is free. Somebody has to pay for it. It's never free. So it's just that you are not the one paying if you are getting it for free, but somebody is paying somewhere. So you may want to pick up private health insurance, and some of them are so small and they will cover you for some of this basic stuff. And some of the money you pay them every month may not be up to the amount some of us are using to buy data or buying recharge card on our phones. So just look for one of them. And I think Lagos State has some of the states governments are now setting up their own insurance. There are other private health insurance that you can use, so that when you now need it, you will get the treatment and you don't have to pay. There's also National Health Insurance Scheme, NHIS, and all that. So let's make use of them. Okay, so make sure you go to the hospital first. Okay, please, whenever you see your doctors, always ask them, what is wrong with my child? Ask them, what is the diagnosis? Some of us are only interested in what they're going to give us. I've been to the hospital, they gave me drugs. That is not the first answer. When you go to the hospital, what is wrong with the child? Before you leave the front of the doctor, what is wrong? Is it malaria? Is it infection? If it is infection, ask them, is it bacteria or viruses? Because that will help you to understand the drugs that your child is being given. So you know. If the doctor has not done any tests, if the doctor has not demonstrated to you that this is this infection, then you will know, so that they won't give your child drugs that is not necessary. It's so important. You have a right. We have a patients and patient rights and responsibilities, something that's a document that was launched by our former VP recently. I think we posted in our Facebook group. So you have rights as user of of health services, and the professionals have responsibility to tell you all these things. So don't feel like they're going to shout on me for questions. No, we shouldn't shout on you. It is your right to ask, and it's our right to tell you. And whenever they tell you this drug I'm going to give your child, you need to ask them question. What is that drug meant to do? What are the side effects? How long am I supposed to use? Do you know how many people come to me and say, I've come back from the hospital, the doctor didn't tell me how to use the drug? I'm like, seriously? You went to the hospital, the doctor gave you a drug, the pharmacist dispensed the drug, and nobody told you how to use it. All those professionals have failed you. And maybe you also failed yourself, because you should have asked. You should have asked. But then we too should have told you. But please, these are kind of questions you should have. You should not get home and start saying, how many tablets should I get? How many? No, that is the job of whenever I prescribe medication, I'm telling you, even before you get to the pharmacy, I'm telling you, this is the amount, this is how much you're taking, I want you to take it twice a day, I want you to take it once a day, this is one tablet or 5 ml, whatever. The doctor must tell you. And I'm telling you, these are the side effects that can happen. Your child may have a little bit of diarrhea, the child may have a little bit of, if this happens, then stop, come back to me. If this does not happen, continue your drug for 5 days, 7 days. We must tell you all these things. So if your doctors are not telling you, ask before you leave. Don't wait until you come to ATP to come and ask, because I always say go back to the person who prescribed the drug, because seriously, it is part of your contract with that person. That person should be the one telling you how to take your drugs, the side effects. It's a contract, it's a medical contract. So we that were not part of it, we're not supposed to be telling you that. And the pharmacist who is dispensing should also tell you. And sometimes pharmacists challenge our prescription. Yes, that is their job, because they know about the drugs. And if they're saying, so some of you say, oh, the pharmacist said this drug is not okay for my child. So in that scenario, go back to the doctor. Ideally, the pharmacist should have called the doctor and say, and they should trash it out between themselves and agree. But if not, just go back to the doctor. It's difficult for us to do that on ATP for you, because I can't comment on medication that I didn't prescribe. Number one, I don't even know whether the person prescribing it for you in the first instance is doing the right thing. So I cannot be the one now telling you to go and use it, because then I become liable as well. But I don't want to become liable for another person's prescription. So that's why I always say go back to the prescriber. But make sure you ask all these questions first. Please stop using, don't give your child antibiotics for cough, catarrh. Don't give them antibiotics for diarrhea. Give them ORS. Okay? Which other one? Don't give them antibiotics for, don't give them tetracycline for diarrhea. Don't give them flagyl. Let's just stop that one. Okay? If your child is having fever, give paracetamol. Don't give them anti-malaria. Yes, that's the last one I was trying to remember. Don't give them anti-malaria. If they have fever, you have to go do malaria tests. Like I was telling us on Monday, we now have what we call the rapid malaria test kits. There are tests that we just take a small drop of blood. We just puncture the thumb or whatever, the finger of the child, get just one single or two drops of blood, put it in this automated machine. When we go on outreaches, we do malaria tests before we treat the children. This, I'm talking on the field. We go to the villages, to the field, and we do malaria tests before we treat those children. We do it. So if we can do it on outreaches, you know, how much more our hospitals? Most hospitals can do the rapid malaria test, and they'll be able to tell you within 30 minutes if the child is having malaria or not. So they shouldn't just be treating you for malaria without testing. So that, because if not, even we are not having malaria resistance, malaria is also developing resistance to the ACT, to the artemisinin, testonate, and all that. And if that should happen, we are done for as far as malaria is concerned, because we don't have anything else apart from quinine. There's nothing else. After artesunate, there's nothing else. Our chloroquine, all those ones, they have already become resistant. We don't even use them anymore. So we only have this artemisinin based, and then we have quinine. That's all. So and now people are beginning to develop resistance to artesunate, and then we are going to get into big trouble. So we really need to work and make sure we don't abuse these drugs. We use them only when it is absolutely necessary. And I think if you do your part, if I do my part as a pediatrician, I don't prescribe antibiotics when it's not necessary. I don't give it when it's not necessary. If you do your part, you don't give it to your children when you don't go use drugs that has not been prescribed, then the rising scourge of antimicrobial resistance will go down, and we will not have deaths from the fact that, because it's a very risky thing. WHO, everybody is looking for solutions to it now, but I think the solution is with us. If antibiotics is left over, throw them away. That's the temptation. Some of us, you use drugs, you use it for 5 days. You will not say, let me keep the rest for rainy day. Throw it away. Don't keep it. Don't keep it. Even if it's a tablet, I know you don't like to throw away your tablet. Please don't use it. All right? Don't give antibiotics. Don't use it. And if we give you antibiotics and we say, please, madam, use it for 5 days, even if your child is better on day 1, you must still use it for 5 days. Even if your child is better on day 2, the child is well, thank God. The doctors are working. Yes, but please finish it. Finish it for 5 days. It's a reason why some of you say I forgot. I'm like, how can you forget to give antibiotics? How can you forget to give medication? Please, you have smartphones. Put reminder, medication at 6 a.m. And please try and give your own medication. Don't give it to the school to be giving your children. The schools don't have, they are not liable for your child. You are the one responsible for your children. So Actually, that's why for children I like to prescribe all these once a day antibiotics to make life easier. Unlike some, but unfortunately, some antibiotics like ampiclox have to be every 6 hours. Some have to be every 8 hours. Some have to be every 12 hours. So if you say something is 8 hours, please make sure it's 8 hours. Don't give it as the spirit leads. No, if you say something is 12 hours, it is not BD like you give one in the afternoon, give one in the evening. No, if it's 12 hours, it is 8 a.m., 8 a.m. in the morning, 8 p.m. at night. You have to give it like that, not just any 2 times a day that you like. No, you have to make sure you skip this. And when you finish with your antibiotics, please throw away whatever is left. Okay, don't give another child, especially mothers of twins. You are the guilty ones. Taye is sick, we are treating Taye, you make sure you give Kehinde. Please don't. That is antibiotics misuse and abuse. They are two separate individuals. I know you like to dress them the same and buy everything double, but please, when it comes to antibiotics, don't double it for them. Don't give Taye what we give Kehinde. If Kehinde is not sick, don't. I know it's Yoruba culture, but please don't. You are setting up the other child for something else. So please, let's not give, and don't copy and paste. Okay, my first child is sick, have cough, this, and the doctor has given this. Now, oh, the second one is having this. Let me also just go and let me not bother going to the doctor again. I know it's the same drug she's going to try. No, man, no, sir. It's not going to be the same. It may not be the same. So please don't copy and paste or duplicate drugs. I am very passionate about this topic because I see it every day, and I really wish I have the magical ones to do something about it. But I think this is all I can do, is to encourage you and support parents to stop misuse and overuse of antibiotics. And together, because I've actually lost a child when I was in Louth that died from the fact that the child was in ICU. We tried all the drops. I'm serious. We tried all, and the parents have the money, so it's not a money issue. Nothing worked, though, and we lost that child. It was antibiotic resistance. In the lab, everybody, all of us were on it. Nothing. So please, let's not misuse antibiotics. If your child is sick, go to the hospital. Let us tell you what to do and do it. If your child is not better, come back to us. Don't say that the doctors are useless. There are many reasons why drugs won't work. I can't go into that today because my time is up. But come back to us. Come back for follow-up, and we'll tell you what next we can do. So I hope you have learned a lot today. And if you have any questions based on today's presentation or webinar, please feel free to go to Ask the Pediatrician Facebook group and drop your questions there. You can also email me, askthepediatricians@gmail.com or Dr Gbemisola@askthepediatricians.com, and I'll try and answer your questions. Thank you so much, and have a wonderful evening. Till next week, whether myself or one of my colleagues come back and talk to you about another topic, have a wonderful day. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.